Enterprises, ITD, and Jack in the Box. Morning. Therese Arriola, the director of the Guam Behavioral Health and Wellness Center, joins us in the KUAM News Zoom room. Good morning, Therese.
Good morning, everyone. Hope everybody had a very restful and some people 3-day weekend. But as we know, there are a lot of people and a lot of things, agencies that are open 3 days, 24 hours a day, 7 days a week.
Right.
So
And
I wish them a happy Labor Day sometime soon, at least some rest.
And we'll just start there because we know the Crisis Hotline over the Guam Behavioral Health and Wellness Center has is up and running 24 hours a day. Therese,
That's right.
can we talk about the traffic, the number of calls? Has it ramped up during the surge?
Absolutely. And we're not surprised. There is a great correlation when positives go up, when deaths are announced. We have an uptake on the calls in the crisis center, and that's just a natural reaction. People become more worrisome, people become anxious, and so we did see a very big uptake in July. Our numbers were about 700. It's been averaging for the whole year, the past year, about between 600 and 700, which, as you know, pre-pandemic, which means pre-2020, our hotline was always available 24/7, but if we're lucky if we got a call a day, 30 calls a month. It's not that way anymore. It's the norm, and a part of the department, we're pleased because that means the number is getting out and people know more about the number. And then the numbers, the high numbers, of course, show that people are actually reaching out. So even though the numbers look high, there is a good indication that the stigma of receiving help and knowing where to get help is known by the community more and more. So that's the silver lining, if you will. The negative part is, of course, that people are needing to have to call for help, which means people are suffering, and people are concerned about the positives, which is normally greatly directed to the Delta variant. I went to the doctor a couple weeks ago right before the real big surge for a regular checkup. And my physician told me, Therese, be careful. This Delta variant is much more contagious. For whatever reason, it's just more contagious, and just be extra careful. So, being the person I am, I'm just like that. I carry literally the hand sanitizer, and there's Sabrina as we talk about it. It's automatic.
I know someone like that.
I do the same thing. I practically carry the bottle around. The minute I get out of the car, if I have to go to the grocery store or to anywhere where there's real public people, I am literally carrying my own hand sanitizer. I'm spraying my own cart down. It's better to err in the side of caution. I definitely don't, knock on wood, have been trying to keep healthy. The crisis hotline is available for everyone. Again, that's 647-8833. We are open 24/7, so a big shout out to my entire team at the Crisis Hotline, Guam Behavioral Health Crisis Hotline, as well as the units and the homes that we manage, because there are, as I mentioned earlier, people who work 24/7. They did not have yesterday off like some of us did. And so I thought of them and everybody, having to go to an appointment yesterday. I passed by several fire stations. It's natural for me to look and to see if the fire trucks are there. And I passed by Barragata and Tamuning, and both of them were empty. So the first thing I thought of was they're out responding because the trucks and the paramedic vehicles are not there. And so Even though yesterday was a holiday for many, it was also not a holiday for a lot of people, first responders, healthcare officials. And so a big shout out to them, and we wish them God's blessings.
Therese, 700 calls a month during the
that
surge.
Was July.
Right, yeah.
We're looking at, I don't have the accumulated data yet, but it's looking like upward about 800 plus for August.
What are they saying?
Which is was our highest, was the surge month, right? And more deaths were announced. Yeah. There was a period where there were no deaths, and thank goodness, but then the deaths started coming. And it's unfortunate because what I saw just as a layperson reading the reports is the deaths are coming from people with multiple health problems. But more importantly, I don't know if you guys noticed it. I'm sure you have. They were elderly, uncle. And so, what does that tell me? That we either isolated them very well, and we became relaxed as a community. And when the surge happened, they were exposed. I'm sure non-intentional, but they were. And unfortunately, a lot of them were not vaccinated. And, I just want to talk a little bit about the vaccination. The vaccination is not a cure-all. We all know that. A lot of people are still catching COVID with being vaccinated. But the big difference is that those who are vaccinated have a fighting chance of controlling and maintaining that virus and pushing that virus out of their bodies even better, even easier. They're not getting as sick. When I say that, people who are vaccinated are catching the virus for whatever reason, whether it's their exposure level or their behavior practices, but they're not, compared to the unvaccinated, not getting so sick that they have to be admitted to the hospital. And that's really the concern. If I was going to get sick, knock on wood, I pray to God that I'm not that sick and that I can ride it out at home, with the advice of the physicians and public health. And so I just worry with ICUs being high and everything, it's not like COVID is the only issue that our community is fighting. We have a lot of people with cancer, heart disease, all kinds of things, normal accidents, non-COVID related, that need to get into the ICU. We need to, unfortunately, we can't go to the next county or go to the next hospital. We only have one public and one private, and they're pretty busy right now. So I tell my friends, I tell my, my family, don't get sick, whatever. And they're thinking, no, we're protecting. I'm not talking about COVID. Of course, I always talk about COVID, but I'm saying don't get sick. Drive carefully, don't get into an accident, eat healthy, don't get a heart attack, because this is not the time to be debating whether we have a room for you or not, unfortunately.
Therese, I wanted to go back to the phone calls to the crisis hotline. Yeah. Do you have a breakdown in terms of like the age groups? Are we seeing an increase in younger people calling the hotline?
It's pretty much average across the board, but you're seeing a lot of 30s, 20s, 30s, 40s, and that's like, I think that's more or less those who are in tune with the news. They're worried, they're hearing it, so they're calling. They're worried about the surge. Is that going to do something to my work? What's going to happen? They're doing, so that's really the range, right? From 20s, 30s, 40s. And, it being Suicide Prevention Month, I just want to say it's ironic because that's exactly the age group that in 2020 we saw. I don't have the data for 2021. We won't have that data until the end of the year. But analyzed. But for 2020, that's exactly the age range, 20s, 30s, 40s, predominantly in their 30s. What does that mean? People who are probably have families already, children, concerned about economic well-being. They have people's probably livelihoods on their shoulders, and they're worried of getting sick themselves and being able to provide for their families. So that's the unfortunate thing. Recently, in January of this year, and I've mentioned this before, Guam Behavioral Health was able to apply, and we got granted and is recognized as a suicide lifeline partner in the United States. So besides the 647-8833 Guam Behavioral Health Crisis Hotline, many people know the 1-800 suicide line in the national hotline. And so when they do call that in the past, prior to 2020, from a 671 area code, they were not able, they got the immediate attention through the call with the with the system in place, but they did not get a wraparound service that brought them to Guam so that they can actually walk in and we can service them. So that was prior to 2022. We, in this year, applied and was granted as a partnership, and now, thank goodness, those who do call the 1-800 suicide line is able to be rerouted to Guam Behavioral Health. So they're going to get local assistance, and if needed, walk in the door. We can track it. I can say that in the month of August alone, there were 29 calls to the 1-800 suicide line generated from a 671 area code number. 29.
Right.
That means 29 of our people was feeling like they were going to hurt themselves, and they called the 1-800 suicide number. But they were able to get a local response here at Guam Behavioral Health. So we're thankful for that lifeline partnership. But 29, and that's, I can tell you between the highest take was August 8th through the 14th. I have to look back at the reports of JIC and see if that correlates. Is that the week where it was the highest report? I don't recall right now, but that week alone, from the 8th through the 14th, we received 14 calls from a 671 number. That's strictly suicide related.
Right. Therese, I want to talk about the people that we didn't get to. Let's look at some of the data here. We've reported 18 suicides in the first 7 months of this year, 40 in 2020. That's so alarming.
Is that yeah. Well, it is. I mean, I'm not sure where the data is coming from. Maybe from the medical examiner, perhaps, or just from the community. We know that some families have come out and admitted that their loved ones committed suicide. It's unfortunate. And look at the range, huh? Look at the age range in their 30s. So it's correlating from the 2020 data. And it's unfortunate, but I have to believe in this line of work that there were more people who got the help. Now, these folks, these souls that we've lost through suicide is really unfortunate. And it's so, September being Suicide Prevention Month, more and more I just need to say out there that the more people in the community that can take the basic awareness, suicide awareness called Safe Talk or Assist training, the better. We know Guam Behavioral Health is doing a lot of training with school personnel, with different groups in our community to identify those who are suffering with suicide. and not be afraid to approach them and ask them if they need help or if they are thinking of hurting themselves.
Right.
You know, the practice in the past is you never want to say anything to anybody who's thinking, because you think that that's going to trigger them to do it. And nobody wants to take that responsibility. That the data doesn't show that. Actually, the data shows the opposite. The data shows that those who are hurting inside and needing to reach out for help appreciate you probably extended their life for a day or two because somebody reached out to them and said, hey, I noticed that you're not doing well. Are you okay? And not being afraid to say, are you thinking of hurting yourself? Please don't. How can I help you? Can I be with you? Let's go seek help. And so that's the unfortunate thing. But, you know, September is Suicide Prevention Month. And so we need to do everything we can as individuals, and not just the healthcare providers, not just Guam Behavioral Health. But I believe it'd be wonderful. I know we're working with some companies to get their staff trained to see these things, especially those who are seeing a lot of people from the outside or public, you know, and because especially during this time, in this pandemic, there are some of us who are handling it well because we have better preventive and coping measures in our lives. And there's some of us who are struggling very hard. Maybe they already have depression or anxieties prior to COVID. COVID was just was what tipped it over, and they're really struggling now.
Right.
But remember, anxiety and depression is not just COVID related. This is a serious concern for many residents of our island who are struggling with it prior to COVID. And COVID just made things probably harder to handle.
Right, you're right.
And so for those people who already are struggling with anxiety and depression and are seeking and have already sought services, they're either seeing a therapist or on medication, the best advice I can tell you is keep it up. Keep up the good work. Continue to see your counselor, your provider, your service provider, your doctor, and continue to take your medication. This is not the time to give up on all of those levels of services that you receive today. And for those who haven't received services, please reach out to us. Guam Behavioral Health is here to help you. That's what the Crisis Hotline is for. You're not alone. Again, you're not alone.
Therese, there's so many times when we hear these cases where someone commits suicide, a lot of what you hear afterwards is, oh, I had no idea. They were so full of life. Oh, man, was there any sign? So I know when we talk about like reaching out to people, and there are those people you can just tell, right? Like, oh, something's going on. Let me reach out. But what about those people who keep it inside so well?
That is why, Chris, that is why the rule of thumb, the golden rule, is to be wonderful and good to one another, because you just never know. That one smile you give the person down the aisleway of a grocery store might be the one that keeps them going for another day. So I'm a big proponent of being good, the golden rule, being good, being kind to everybody. There is enough ugliness in this world. We do not need to create enough other external ugliness. And so a lot of people ask me, Therese, what do? You seem, I'm phased. Of course I'm phased. I'm worried. But I'll tell you, prayers do a lot. I don't do a lot of social media. I'm sorry, I just don't. It's part of, I listen to the news and I look at the headlines because I have to, but I really, really censor my news. As human beings, we can get caught up on all the negative, and there's enough negative in the world. We do not have to, I don't need to read everything. And so my advice to a lot of people is censor and monitor and limit your exposure on the social media. A lot of people are, you know, it's interesting because Facebook and things like that have become people's public diary. You know, as a kid, you had a diary, right? You put your thoughts in a book. But Facebook and whatever all the other social media has become what I call people's public diaries. What I ate today, pictures of what I ate, you know, who I did it with, I mean, who I went somewhere with, and, you know, thoughts, right? Random thoughts that they're thinking are putting out there. And I just, the random thoughts that are put out there, if you're hurting, I'd rather have you reach out to somebody like on the Crisis Hotline and really somebody who can help, rather than just putting it out there and having all kinds of comments that may or may not help you. And so if somebody needs to talk, if somebody is struggling, whether they have a bubbly personality, like you mentioned, Chris, a lot of the news today, we saw individuals who have passed because of suicide, who people never thought they were struggling. Right. So what does that tell you? You can't judge a book by its cover, right? And so again, back to the golden rule, being kind to everybody. I'm a true believer. If you don't have anything nice to say, don't say anything. Don't say anything. Because there's enough pain and ugliness in the world. This pandemic is enough. I don't need to hear gossip or ugliness from other people. And so we just need to, as a community, I feel like we're losing, you know, as a Chamorro woman, you know, inafamalik. It drives me crazy when people use the word inafamalik very loosely. Inafamalik means taking care of somebody else. It's about unselfish acts of others, making sure that others are cared for first before ourselves. So imagine if every single person on Guam truly practiced the true intent and the true value of inafamalik. We won't be hurting each other with words and other things. Would always be worried about the person's well-being before ourselves. And so I just, you know, say hi and smile. It does not hurt to smile at somebody in the aisle. It might be that one person that you never thought was thinking of hurting themselves walking out the door. And that smile alone probably was that person's only smile that day. And you probably extended that life of that person. So I don't want to be so gloomy. I mean, yeah. I think life is beautiful, but there are people who are struggling out
Correct.
There that need everybody's kindness.
Therese, I wanted to ask, we hear from Lillian about, you know, the increase in hospitalizations, and they're at a point where they need to request for assistance from DOD, kind of like what happened last year. And so I'm just kind of curious on your end, since you are seeing an increase in people calling the crisis hotline. You said 800 plus just last month alone. Do you have enough medical personnel, psychiatrists, psychologists, nurses over there at Guam Behavioral Health and Wellness Center, and also, I guess, maybe even the space to accommodate?
Never enough. Never enough.
Mm-hmm.
First of all, professional services like psychiatry and psychologists are just nationwide, or I should say worldwide, a smaller group, just too little of them. I can tell you today that I am aggressively recruiting psychiatrists from locum tenens, which means, you know, they're the traveling doctors, like what GMH used to, or still does. They bring in to fill the gap of their shortage of workforce. Locum tenens is recruited, which means we pay a higher price but we get their warm body on Guam. So we're doing that. We're doing a lot of aggressive recruitment. You know, in 2019, when we first got into the administration, we applied to be a HRSA site, which allows us, it's a recruiting tool. We were able to get a HRSA score of 19. It's a recruitment tool. People who are looking, who come out of college, whether it's social work, counseling, healthcare professions, and they're looking for a employer that they can apply for debt relief. As you know, a lot of people go to college and they carry out a very big student loan coming out of school. And so we are a HRSA site now. We're at 19. That has helped tremendously. We're getting some very interesting bites in our recruitment because there are a lot of people who are seeking to be employed in a site where they can apply for student loan debt relief. So we're doing it all. I can tell you right now that there's not enough psychiatrists on Guam to go around.
How many
We know
do you
there's
have on
about
staff?
5 or 6 licensed only, and we know them all.
How many
We
do you
know
have
them.
on staff at mental health?
Guam Behavioral Health has 3.
Psychologists?
No, that's just psychiatrists.
Psychiatrists, okay.
Yep. We have 2 psychologists, but we're recruiting aggressively for both of them.
Yeah.
Counselors is always needed. Mental health counselors, just counselors in general. Social workers, there's just not enough of them to go around to all the agencies that need social work, and who is the coordination of services for individuals. So we are always in high recruitment. If there is a social worker or a counselor, especially a counselor who has a master's in counseling degree, and wants to get back into the field or hasn't found a job in the field, please send us your resume. We will definitely be talking to you the same day. We're working with the University of Guam. You know, the University of Guam only puts out so many graduates a year, and they are not, they're not putting out specifically for Guam Behavioral Health, right? So all these counselors can go other places, can go private practice, then can go to private clinics, as well as social workers. They're not just putting out social work degreed graduates for Guam Behavioral Health. There's social workers that are needed for public health and GMH and other places, other agencies and departments in Guam. So we're all fighting for those graduates, right? And there's just not enough. I can tell you that there's some graduates that don't get into the field probably because they needed to make money, and so they got into the first job that they could to make a living, right? To pay their living wage, to live their lives. And so for those who have degrees in these fields and want to get into the field, because some people get a degree in one field and their career is in a totally different field, right? You know, talk to us, because we're definitely always in recruitment mode. Always, we have open recruitment.
Well, thank you, Therese, for coming
on an uptake, if I could just, you know, we have, September is not just Suicide Prevention Month, it's also Recovery Month.
Yes.
Addiction Recovery Month, right? So two big proclamations that were put out last week by the governor, and they both fall under Guam Behavioral Health. So, you know, we're excited because the highlight is Guam Behavioral Health, but there's a lot of work to be done. There's a lot of responsibility as the agency in charge. And so I just want to promote 2 things. September 21st and 22nd is Guam Behavioral Health 2nd Annual Substance Use Disorder Virtual Conference. Last year we had over 800 from around the world. This year we're open again. We can take as many as 1,200. And then, so we look, you know, those who are interested in substance use disorder, addiction. There's going to be a lot of speakers from off island and on island. And then September 29th begins a 2-3 day conference called the Guam Behavioral Health Go Peace Suicide Prevention Conference. Part of that, one of those days is Assist, and Safe Talk, their trainings. So if you're interested in any of these two conferences, they're free. Please look us up on Facebook or look us up on our Guam Behavioral Health website, and the information is there. These conferences are free for all, and I can tell you right now that when it comes to suicide prevention, as well as recovery, I don't think any household is untouched either way. We all have the responsibility to help our brothers and sisters who are hurting, whether they're suffering through substance abuse or quietly suffering and thinking of hurting themselves. We all individually have a responsibility to be good and kind and service one another. That's the golden rule, and that's how we roll at Guam Behavioral Health. So
this is how we roll.
That's how we roll.
Thank you, Therese.
Thank you, everybody. Be safe.
You too.
Take care, okay?
That's the 647-8833. That's the number of the crisis hotline over there at Guam Behavioral Health and Wellness Center. Yeah, just reach out and touch someone. And, you know, to kind of expand on what Therese said, you know, she said that smile at people, right? Because it could be that one smile that they need.